So some of you have been to national conferences and heard about prehospital lactate, and you've heard us talk about the sepsis alert. And some of you have even seen one of these little guys, a little simple to use lactate monitor. And so I wanted to answer a few questions about lactic acid really quickly, so that those of you who haven't been to one of those conferences or talked about it or read about it will understand very quickly. We could talk about this. So lactic acid, okay? Lactic acid or lactate is a byproduct of anaerobic metabolism. What does that mean? Well, it means if you're not getting good oxygen to tissues, they end up making energy a different way. So they end up producing this byproduct, lactic acid. So it's a marker for when you have poor perfusion or shock. So it also shows up in a number of different ways, but predominantly when we're talking about lactic acid, this is what we're looking for. So in some cases, we're talking about sepsis, okay? And in some cases, we're talking about trauma. So even in trauma, we sometimes want to know what is the lactic acid. Interestingly enough, in the hospital, typically use a point-of-care test that also gives you acid-base status, and that can also help us to talk about respiratory status when they arrive, which we do in the field predominantly with end-tidal CO2. So keep those two things in mind. If you had a prehospital lactate and you had an end-tidal CO2, you could make some inferences